Welcome everyone to the Alumni Symposium on Innovations in Dentistry. Our host and moderator today is Dr. Gallucci. Dr. Gallucci has been with HSDM since 2005. In 2007, he established the new postgraduate education program in oral implantology and has served as a director of the Division of Regenerative and Implant Sciences in the Department of Restorative Dentistry and Biomaterials Sciences. Just last week, Dr. Gallucci was selected as the Raymond Nagel Associate Professor and Chair of Restorative Dentistry and Biomaterial Sciences at HSDM. We are honored to have him here with us today. Please join me in congratulating him on his appointment and welcoming him to the podium. Dr. Gallucci.
Thank you, Jessica, for the opportunity. Good morning, everybody. I know this is always a special day for everybody to be back here. I will try to keep this extremely short because the real highlight of this symposium is the idea of discussing with these fellows and colleagues their innovation and how to bring the ideas to market. And HSDM is not new when it comes to innovation. As you all will know, in 1867, we were the first dental school being associated to a university and integrating oral health with systemic health. I was honored to attend a leadership symposium that took place last October, and to see the drive and innovation that this school under the leadership of Dean Donoff is taking on making sure that the oral cavity is part of or taken as a part of the whole body was really enlightening to me. As a fact, we are working now on publishing the proceedings of that meeting because the information was extremely relevant. The tradition of thinking outside the box thrives today on a large scale at the school throughout groundbreaking research, inventive curriculum, and teaching techniques. Our school was also known worldwide for our education, innovation and education. I was in Switzerland when I first learned about the PBL, and I said what a great idea was that, and we were trying to implement that. And of course, I had to come to Boston to learn that there was an idea born here in this institution. Our panelists today will provide a window into how recent entrepreneurial ideas were developed and incubated, utilizing resources across Harvard, and how they will be brought to market as a finished product. So the idea is that we have 3 groups or 3 presentations, very short one, 10-minute presentation. They will present their innovation, and then there will be an open panel for a discussion where you can ask questions, where you can, in a collegial way, somehow challenge and see how we can get these ideas all together. Our first team is composed of 2 Michaels, right? And both whom graduated yesterday, and this is really a true privilege and honor having our own graduates being at the forefront of innovation and taking these ideas to the market. So Dr. Michael Sunwu served as a U.S. Army officer for the 9 years before pursuing his Master in Medical Science in Orthodontics here at HSDM. And Dr. Michael Kang worked as a computer engineer for IBM before coming to HSDM. I really regret that I didn't know that earlier, otherwise we would have had much more interaction, but true. I have seen both of them in action in the clinic and in different research seminars, and they're true stellar students with a bright mind, and their ideas are really surprising. Together they comprise DentoQ. Is that correct? DentoQ. An exclusive network made by dentists for dentists, where patient information can be shared in a HIPAA-compliant manner, which is a very interesting topic nowadays, the way we handle information for our patients, on a mobile device. So that means that you can be on a plane and you can be making appointments. No, it's not really. They will tell us exactly what their innovation is. Please join me in welcoming Dr. Michael Sunwoo and Dr. Michael Kang, please.
Thank you, Dr. Gallucci. It's a pleasure to be here this morning. Once again, my name is Dr. Mike Sunwoo. This is Dr. Michael Kang, and we are the co-founders of Dentalk. We graduated yesterday, and we're here today. This is so we're very happy to be here. Actually, we are not ready to part ways with HSDM quite yet. So Dentalk is a application that it's a project that we've been working on out of the Harvard Innovation Lab. If you're not familiar with the Harvard Innovation Lab, it is a incubator center made for Harvard and MIT students, basically attached to the business school, where the students can come together, collaborate, and bring their ideas, manifest their ideas into reality. And they provide resources, resources for us and mentors to help us really get things going, and also to connect the different students who have different talents to each other, so that teams can be formed. So, there we go. So, like Dr. Gallucci said, I come from a military background, and Dr. Kang comes from a computer engineering background, and we both met here at HSDM at the beginning of our residencies, and we hit it off at the very start. We both share a passion for innovation and technology, and we both want to improve dentistry in ways that haven't been explored yet. So, unlike medicine, the majority of dentists, 85% of us, actually work in separate private practice clinics. So that means specialists can be miles away from each other. And so when we're collaborating with multi-specialty treatment, dentists need quick, efficient ways to exchange patient information from office to office. And if we're very busy seeing 50 patients a day, we really don't have time to talk on the phone or send faxes. Additionally, poor communication is the leading cause of healthcare-related errors and costs the country over $8 billion a year. Hospital studies show that 90% of doctors use smartphones, and 50% of them are sending work-related text messages. We believe the same is true for dentistry, and we conducted our own research here at HSDM to validate this issue that Dr. Michael Kang will talk about. This is a big problem because federal privacy regulations, or HIPAA, prohibits unsecure transfer of patient information through standard SMS or text messaging. And as of January 2014, these violations can result in penalties of $50,000 up to $1.5 million a year. And these breaches are taking place all the time in the hospital setting. So to remedy these issues, we created what we call Dentalk. And Dentalk is the only professional network made exclusively for verified dentists and dental students. Dentalk provides secure HIPAA-compliant text messaging through emails and PCs, text messaging and emails through PCs and mobile devices. Dentalk provides a treatment portfolio which allows dentists and dental students to collaborate and share cases through albums and photos and x-rays in a secure manner. And our geolocator allows users to find other dentists who take certain insurances, have specific expertise, so that they can send specific focused referrals. And users have the peace of mind knowing that Dentalk is 100% HIPAA compliant. So this is a snapshot of our website, and our website, what we have is a very secure, verified registration process. You cannot be a user of this without having an MPI license. So we have our method of verifying individuals is based off the information used on their license credentials. Here's a snap of the website profile page. And now Dr. King is going to talk about the research that we conducted here at HSDM along with a demo of our application.
So good morning, everybody. So how are things in social media for dentistry? So according to the recent statistic by Statista, which is one of the internet media company that deals with statistics in basically anything. In 2012, there were about 1.4 billion social network users, and it is expected to grow by 50%, and that's at 2.13 billion users by 2016. So as Dr. Sono mentioned before, there's no dental-related specialized social media for dentists and that allow HIPAA compliant sharing platform, which we created. So we decided to do a study just to see what's going on in dentistry. And plus on top of that, we didn't understand how people are using mobile devices in whole scheme of things in dentistry here. So 108 anonymous paper surveys were distributed, and that had 31 questions asking basically the information about demographics of the participant, various software solutions utilized, frequency of use, and most importantly, whether if the device is utilized in storing and transferring patient information. So just to show you some highlights of the survey. So this was basically the demographics of the study. So if you look on the left upper side, you can see the different age groups composed of predominantly 35 and younger, which basically represents the population of the dental school. And also if you look at the distribution by the class, D3 and D4, as well as the residents, are the predominant population in this survey. So skip all the other questions, I'll get to the very core of it. So some direct questions we asked. We asked questions about, have you stored patient information or shared information on a smartphone? And the 78% who responded to this question said, or 55% of that said yes. So these are potential breaches of HIPAA. And also, have you shared any information on a tablet device like iPad and things like that, or Android tablets? Surprisingly, a little bit less here, only 20% said yes to that question. And have you shared information on a computer? 70% of the respondents said they do. And Dr. Sono briefly mentioned it at the beginning, but if you are emailing patient information, that is a breach, most likely. So that is something that you should be aware. And one more question we asked, how often do you use mobile device to view, share information about patients here? And more than half. So aside from that 41% who never shared anything on their mobile devices, more than half of the demographics we studied, they said they have shared patient information one way or the other. So in conclusion, it is apparent that potential breaches are occurring everywhere in dental school setting, maybe more so than most of us anticipated. And one of the things we need to realize is we know that texting is illegal to do so when we share patient information, but that is new mode of communication. That is something that we have to embrace instead of ban it. So that's why we created Dentalk. So now we talked about the creation of whole Dentalk here, but we'd like to show you some in action. So it runs currently on iOS devices. We've been working with Apple Developer Network for past 2 years now. And past 3 months, we've been going back and forth with Apple trying to put it on the App Store. But it is rather quite difficult because they're pretty strict on some of the things, and there are different requirements that we didn't know about. So it'll be up soon. So let me show you what we created. So this is basically let me see if I can find my cursor. So basically, are you guys familiar with iPhones? So basically, this basically emulates the iPhone screen. and iOS. And you can see here, that's our little application we created. And then we need to log in. So this login gets created through the website. And then in the website, what we do is we verify your personal information by going through some of your personal information that's not readily available. So what we do is we present information we call out-of-pocket questions that you have to kind of know yourself. And no one else probably would know that answer to that. So we log in, and we basically have, okay, all right, it works. So basically, this is a screenshot of things. So I don't know if you guys use some of the Facebook texting message platforms and things like that. So this is basically the interface that you would utilize. And here I have Dr. Sanu, and these are some of the chat screens that we've been playing with, and I can text him something, and he can text some of the stuff back. And I don't know if you can log in and text me some stuff, if you could. So he's got that. All right, so that's one of them. And one of the, so this is done in a HIPAA compliant manner. So what that means is we encrypt everything. So even though you see it here, the moment you close this app to get back in there, either you have to re-authenticate or put a PIN number to get into it. So the moment you get out of the application, no one else can get in unless you go back in. And also the data itself gets encrypted within the device, that somehow somebody gets this information and wants to hack into the device, it's all gibberish. They can't do anything. And also the HIPAA basically asks you to not only encrypt the data at rest, but at transfer, it has to be encrypted. So we basically do all the other security checks along the way, so things are not intercepted. Even if they intercept it, it's not a data that they can use. So you have different colleagues you can add to, and then you can basically get some quick information about the user, and then you get to see the school that he went to, specialty, experience, in general, other informations. So what we hope to achieve is basically trying to connect all the dentists and collaborate, because I feel dentistry, somebody said it's like a cottage industry, that we don't have checks all that much. Once you're in the private practice, you kind of work on your own, and I think the interaction will open things a little bit more so people can collaborate and learn more. So that's what we have. Any questions? Or
we'll do the other part. Yeah.
Okay, great. All right.
Yeah, in order to use it, both people have to be on then.
Absolutely. So you have to request the other person to accept your invitation, and then you have to connect with each other.
What does it cost?
So should we wait
We're
that?
making it free for now.
For now, we're just trying to grab everybody to just get on it. So we have enough loans. But the hope is we try to get people on the website and the application first.
We have 1 hour set for questions, and I think that is the right setting. So if I know you have a lot of questions, do you want to have the questions right now, or you think that it would be okay that we do all the questions when the panel comes up? Yeah.
Or again, my question.
All right.
If you want to use your PC and don't use the Apple system, how do you turn it on?
So basically what we have is web-based platform. So web pages doesn't matter if you're on a Mac, Android, iPhone, PC, doesn't matter. So that's why we have the web component built into this whole project, so that anybody who has a web browser can
Anybody else at risk of forgetting the question? No? Thank you so much, Michael and Michael. Thanks. So the next theme showcases the concept of One Harvard, integrating different schools and different disciplines in a very unique collaborative effort, and this is something that is really a privilege to have this team with us today. Dr. Shigemi Nagai is an associate professor of restorative dentistry and biomaterial sciences Since arriving at HSDM in 2001, she was working as a full-time faculty member in prosthodontics, and she served as Director of Advanced Dentistry in the DMD program. She's the Director of Prosthodontics on the DMD program. Dr. Nagai has received numerous teaching awards, has more than 35 peer-reviewed publications, and operates her own lab here as HSDM as a true clinician researcher, which is a privilege to collaborate on a daily basis with Dr. Nagai. Dr. Mindy Jill received her DMD from HSDM in 2011, and just yesterday, right, finished her DMSc with a certificate in periodontology. She has received numerous awards and scholarships and held a wide variety of leadership positions in school and professional associations. She's really a hard-working individual. I had a chance of sitting with her in some literature reviews, and I know her questions were very pertinent and very scientific-based oriented. And the third member of the team is Mr. Sid Mirza. He holds a degree in electrical engineering and economics from Columbia University and MBA from Harvard Business School from 2003. Prior to HBS, he co-founded 2 companies in the telecommunications and tech sectors, where he led technology development, marketing, and strategy efforts. He also worked as a venture investor at the Khosla Ventures and Applied Ventures, the corporate venture capital arm, and Applied Materials. And the list goes really on. I will probably let you explain all your achievements a little bit later with the panel. So the group has been working on something very much needed in our profession, which is a device. It's called cavity test. It has grown after Dr. Nagai's primary research, interest and expertise in translational and clinical research. And cavity test is the first caries screening product available as a disposable test, enabling the detection of early caries while they are still reversible. Please join me in welcoming the cavity test team to the podium.
Thank you, Dr. Gallucci, introduced us today. So I just want to introduce myself. My name is Shigemi Nagai. I've been here working 15 years. So I have been involved in caries detection research last 6 years. And we faced problem to make our findings to the market almost 2 years ago. And then we changed our strategy totally different way. So we call it device-free caries detection system. Many systems on the market using handheld camera, light source, and a computer, but we do not use any device. So we are targeting a totally different type of the caries detection system. So, and then I'm happy to introduce my team. So inventor is me, myself, Shigemi Nagai, also my husband, Masa Nagai. So he's my ghost, like my brain. Anyway, and then Mindy Gill, also Sid Misla. So they are my team, and then co-founder of the cavity test. So let me introduce Sid and then Mindy.
Thank you, Dr. Nagai. So what I will do is I'll walk you through what we're up to a little bit, and then Dr. Gill will explain a little more of the science if you're interested in that piece. So these facts are not going to be new to anyone in this room. You know caries are a problem. Lots of people have them. Untreated tooth decay is rampant. People don't use the proper oral hygiene behaviors recommended by dentists, and that non-compliance is an issue. So this is what we realized when we talked to dentists and looked at what's happening today. Dentists are really good at detecting cavities, but in the really early part of the spectrum, there's a lot of ambiguity. It's hard to know what's a cavity and what's not, where's demineralization and where there isn't. And that's the really early stages when it's only about 100 or 200 microns deep into the enamel. That's where you could reverse the cavity by potentially fluoride treatments, better oral hygiene, drinking less soda, basically better compliance with oral health behaviors. So that's where we want to target our product and enable people to learn about cavities at that early stage. There are technologies in the market that try to do that. I don't know how many of you guys have heard about cavity detection devices like Sopro, Spectra, Diagnodent, I don't know, Midwest. People know about it. Do you use it? So a little fewer, but sorry?
Tested it, hasn't worked.
Not yet.
In your symposium a couple years ago.
How's your experience with that?
I've used the Diagnodent, and I felt like it was kind of complex to get proper readings depending on the angle, but also the patient contamination issue was really difficult because you can't just use it on one patient after another, so I don't see it being practical.
That's new. We didn't hear about that. I thought there was some hygienic piece to it. I guess not so much.
I think you're supposed to clean it. I mean, obviously you're touching the patient.
Right.
You have to clean it somehow, or I don't know.
Interesting. What we learned even before this was that it takes a lot of time, and it's sort of, and that was the main complaint. And there was a false positive problem with that. So we wanted to develop a tool that's very simple that can be used consistently across people. And that's where Dr. Nagai and Dr. Gill's research, and of course Masa, who's our chemist, that really helped us develop a product that can solve that problem. There are more of these. So the reason I got involved with this product and with this research is because the concept is innovative in that it's very simple. It's easy to use. It uses behaviors people know how to do. You brush your teeth with our toothpaste, you bite a tray, and the tray will show the extent and location of demineralization on the teeth. So looking at the tray, you can tell if the cavity is early stage or if it's something that needs intervention or a closer look in a clinical exam. And the part at the bottom actually shows the different kinds of results you could get from this test. So this is where there isn't much going on, it's fairly healthy. The middle one is which is probably how my teeth look like. It's probably a little bit of an issue, but something I could probably fix if I were a little more diligent. And that's where, if I had a cavity, that's what it would look like. And that would need more attention. So this is a great slide Dr. Nagai made. It talks about the 4 different aspects of the business. So team is really important. That's primarily, so a little bit about me. I'm part of this new fellowship at HBS that was started last year, and our goal is to commercialize Harvard technologies. So they told me to go look at Harvard and find technologies that were good, and that had a big market potential, and that were a big opportunity. But what was really also important, because there's a lot of things like that at Harvard, what's really important is also to have a great team. So the team was really important. It's different. It's extremely differentiated from other products in the market to detect cavities. The GRAS component, the GRAS, is basically means our ingredients that we use for this products are recognized as safe by the FDA. And we have IP that's owned by Harvard that we plan on licensing. So there is IP protection on this technology, which is very helpful in a product that's going to the consumer, that's potentially going to dentists, but also to the consumer directly. It's important to have IP protection. Otherwise, people who are good, well-meaning people like Colgate and P&G would love to develop this as well. So the main differentiation is that it's potentially also a home use test that can be used by patients to monitor their cavities at home. And it's device-free. It doesn't need an expensive device that you use in the dentist office only. It can actually be done outside of the dentist office and inside the dentist office as an early screening device. There is a mobile application that will enable you to sort of take a picture of the result that we saw from the test and track your results over time, but also be able to better get a sense of what's going on in the mouth by analyzing the results using a mobile phone application. These are all of our collaborators, all the institutions that we're working with. This once again just shows how simple it is. You just brush, you bite, and you see the result. So I guess it's just re-emphasizing how easy it would be to use for the patient. That's the results. So for the science, I'd really like Dr. Gill to talk about this because it's her domain.
Good morning, everybody. My name is Mindy Gill. Happy to share what we've been working on with you all. So before we started really developing, after meeting Mr. Misra, we have to make sure this product works. So today I'm sharing some scientific evidence with you all. So just really briefly, apologize the quality is not that great, but when we look at the photograph of the tooth on upper left, as he mentioned, sometimes it's very difficult to diagnose, especially early caries. We might watch it, we might monitor it, and even x-rays, it's really difficult to see. When we use our cavity test to take impression, so to speak, of this tooth, we get those very strong purple markings you can see on the occlusal side. And but we need to make sure that there really is something going on. And the only way we can do that is using histological verification, which we can only do with extracted teeth. We can't do that in patients. So we were lucky to be able to collect some teeth. And after doing our test, we sectioned the teeth at various sections. And I think you can see these white spots actually demineralized. So when you look at the photograph, it doesn't look like much, but you can see the demineralization actually had already extended to the DJ junction, which was surprising to us as well. And the red, the middle picture is corresponding to this red line, and the picture on the far, your right, is corresponding to the blue. And you can again see evidence of demineralized areas. And this is another example, again, of the tooth that might look benign clinically, and then we see a significant findings with our test. So again, when we section the tooth, you can see on the bottom two picture on your right that the evidence of demineralization is pretty significant. And we did this experiment on almost 100 teeth. And basically, we had 3 different dentists take a look at them and then give us their best clinical diagnoses. And also, we tried the Diagnostic, which is, I think more people are aware of that machine, but again, with high false positive rate. We also tested Midwest Caries ID, and then it says cavity away, but that's the cavity test. That was our earlier name. And you can see that the sensitivity and the specificity, as well as positive predictive value and negative predictive value, is significantly more predictable. I guess in conclusion, we're really happy and excited about this product because potentially we can screen many, many patients before they're at the dentist's doorstep and hopefully try to reverse some of these caries. So, thank you.
Questions? Yes.
Did you also have an examiner look at the teeth and see if they could use icy gas and get, you can do icy gas and extract the teeth? Did you do that?
We didn't do that yet. It takes a number of calibration and some time to do that, and probably in the future works more in large clinical trial. That might definitely make sense to include that.
Well, we have an examiner with a cap of 0.9 on icy gas if we need someone to calibrate.
Great, thank you.
You need a frame to hold the material, and how do you determine the force that a person needs to close into this to make an imprint into the actual fossa?
We do have a carrier. Right now we're testing a few different options. At the moment we're using the partial quadrant tray that we're all familiar with. And the consistency is like a dough material. It's like a gum, I guess is the easiest way analogy. So we would ask the patients to bite down all the way until their teeth touch.
Does it penetrate into the interstitial or whatever you call them areas?
When patient brush, we have some compound in there, some special toothpaste. So brushing the tooth and some chemical goes onto the demineralized area. Then they just rinse it with water, and then they bite something, which we cannot tell at this moment, but patient bites something. There's another compound in that material, and that material gonna make a color reaction with the first material on the tooth.
So it's in the toothpaste too?
Yeah, so two compounds. One is binding agent in the toothpaste. Another compound is in the tray. And then that two compounds meet each other, makes color reaction.
And how do you get a young child to bite?
They can bite, it's a key.
Is the bite effective? Or
Yeah,
will the toothpaste pick it up?
We need to do the toothpaste first, then bite. Different, two methods.
So you got two carriers.
Yeah, two.
If you would like to know more, you will need to pay for the patent.
Who owns the patent?
I'm sure they will welcome some. So we will move on for the sake of time. Thank you so much. This is very interesting. Our final presentation for today, before we move onto the panel format, is Dr. Mary Marfat. Dr. Marfat received a DMSc in oral biology in 1978 and a certificate in general pathology in 1981 from HSDM. She has a long career in academia as a teacher and researcher. Dr. Marfat also has been involved in private practice and demonstrated a keen interest in oral public health. Currently, she is a clinical instructor at the HSDM and a clinical assistant professor at Taft School of Dental Medicine. Her innovation that she will present, I give you a little bit of background. She came long ago to my office with the idea. I said, I really don't know how I can help you with this, but we connect Dr. Marfat with the Office of Transfer Technology Development. She had several meetings, and then the organizer of the event decided that that would be the right setting to present one of her innovations. So, Dr. Marfat, if you wouldn't mind coming to the podium and present your innovation, please.
Thank you, Dr. Gallucci. And I don't know if it's good morning or we are very early good afternoon. At any rate, I'm very happy to be among the colleagues and friends, Dr. Grolnick, Dean Donoff, and Dr. Gallucci and everybody else. My name is Mary Marfat, as Dr. Gallucci mentioned. So this, I give you a little bit of a background that I don't have all my slides. I'm by myself at this point, and it's in the early stage. So I apologize if there's not enough information out there. I try to mention it myself. My interest in oral health, systemic health and public health, and also consideration to diversity and underserved population has motivated me to think about this product and make this product. Beside that, I really, I wanted to say at the end that being able to think outside of the box and also thinking about problem solving is something that I learned at Harvard School of Dental Medicine, and my mentor was late Dr. Jerry Shklar, and all my blessing to him because he passed away about a couple of months ago, and we have a memorial for him today, plus a lot of other people that I would thank at the end. So this is the reason I came and I thought about this, and the reason behind it, as you see in here also, it's the ease of use. It's a pump that can be used manually or electrically, and also is very economical because you can have one container for the family. Also is very hygienic. There is no cross-contamination. To this liquid toothpaste, also it can be therapeutic because you can add a lot of other material. It can be antimicrobial, antibiotic. It's much easier to add to a liquid than to the solid process that we have. So it's really an improvement for the public health and also for what we have in the market. I'm hoping that we can have a liquid toothpaste like we have liquid soap instead of the soap bar, so we can have improve what the tools that we have in the market today. We have another slide. Thank you. This is a very simplified, just the original sketch. I apologize. Now that I have the patent, it's a lot more organized, and I have a real pump with a place for the toothbrush, so it really doesn't touch it. And so there's no chance for cross-contamination. And as I said, you can add a lot of, and I am in the process of thinking of prescription toothpaste that you can add a variety of different components according to the patient's needs. So this is my very brief introduction to what's going to be done. There are several generations, and right now we have the patent for the pump, but there's a lot to be done with the prescription toothpaste and the materials that we can add to it. I would like to thank Dr. Gallucci for helping me, Dean Donoff, Dr. De Salva, Dr. Howell, which I don't think he's here, Dr. Barron, and also 3 people that they have been extremely helpful in my development, Dr. Jerry Clark, Dr. Goldhaber, and Dr. James Shaw, that they are not here with us, but my blessing to all of them. As I said, if it wasn't for them, the process of research, learning problem solving, and thinking outside of the box, I would not be able to think about this project and go ahead with it. Thank you for your attention.
Thank you very much. I was just thinking if I can make a comment. I would really like to have one of these in my kids' bathroom, but can it please be manual and with a parental control? Sure. That would be really helpful. All right, so I think that we have interesting ideas. I would like to invite all the groups to take a seat here in the front so we can open the panel for discussions. I have a set of questions here, which I would like to use one of those first to kind of warm up the discussion, and then we will open it to the audience for further questions. So I thought that the most relevant question, and as a research and initiatives and ideas are always born out of an inspiration that comes from something. So I would like to ask the panelists, what was the inspiration for your products, or what are the inspiration in general that you get that motivates you to do these inventions? Dr. Nagai, you have the microphone.
Yeah. No.
You should talk about inspiration.
Inspiration?
Yep. The inspiration. What was your inspiration for this product?
It's a very good question. So I've been using bisphosphonate to use for the caries detection last 6 years, maybe. So, and when I met the professor, Dr. Moon, at Harvard Business School 2 years ago, so actually she killed me. She killed me because saying, Shigemi, you need think about coffee maker. Mm-hmm. What do you think? It means a coffee maker, some small boxes in the kitchen, or some like a front desk. So this is not innovation. If you want to do something innovative, you need something nobody can think about. So caries detection, everybody using a handheld device and a camera, computer. So this is not innovation. And then she told me, and you need one more new layer of innovation to move this project forward. And I was thinking maybe 5 minutes. Then I come up with this kind of idea, brush, bite, and she was so happy to know my new idea. Then it was 2 years ago. And then I worked with my husband. He is a dentist and he's a chemistry, molecular biologist. And we found all this chemistry component. And then we just started some ex vivo experiment last year. After 5 o'clock weekend, also, right, holidays, all the time with Dr. Gil in my lab. So inspiration, why I got this inspiration? Because of business school professors.
So I also saw that Dent Talk, you have an application feature on the main basics of your innovation, and so does Cavi Test. Perhaps you should have a talk after this forum and see what areas for collaborations are in there. But Michael, what was the inspirational factor in this innovation?
So we knew that this was an issue. We both have experience in private practice, and we knew that this was a problem that we faced and other people have faced, just communicating and sending records between offices and practices. It's not a new issue. It's been around, and there have been attempts on the medical side to solve this problem. And some groups have been very successful with it. And so we realized there really wasn't a lot of attempts to solve these issues on the dental side. And we figure we are here at Harvard. We have resources and mentors that are here that can help us with it. Why don't we try to take a stab at it? And so we talked about it and felt like it was something that we could do. Didn't really realize how much work it was going to entail until we started doing it. But it again, it's kind of got going and got more and more excited about it, and that's how we got the ball rolling.
Now that leads to my next question, and is when you get into this innovational entrepreneurship within the Harvard University system, how much support do you feel that you have across the institution? And perhaps, Dr. Marifat, you recently experienced that, so you can tell us about that.
I think I came to your office and you really referred me to the right. No, it's really the truth. And I was referred to the right person. And right now I'm the stage, at least for the first part, to develop and market it. So I met with Grant Zimmerman, Mr. Grant Zimmerman, and then he referred me to Mr. Lars Fischer. So I'm in the process of working with them. Thank you.
From the research viewpoint, Mindy, can you comment the support that you had for developing this?
Sure. Well, my personally greatest support is Dr. Nagai. And through her, I learned a lot about the resources that Harvard has to offer. The Office of Technology Development with Grant has been a huge help for us from day one in many of the inventions that Dr. Nagai has been involved in. And they're sort of the best bridge to help us connect with even more resources available across Harvard and MIT. And that's how we actually met Sid as well. So I think we've been very fortunate to be in the right place with the right people helping us.
And before I open these questions to the panel, this is a perfect timing, Sid, because I think you should answer this question. What are the steps involved in getting an idea to the market? And I know this is probably a question that it will take a whole day, but what are in your opinion, Sid, the question is for you. What are, in your opinion, the logical steps that any researcher or any idea should go through before or in order to get into the market?
Before he gonna say something. Yeah. So OTD is excellent, as you know, but we don't move forward only having OTD, nothing. Maybe we can submit the patent. To make a project from the lab to the market, we really need Harvard Business School people.
Okay. All right.
I think the main question that we're going to keep asking for the next year and longer, and what I started with, is do people care about the product? Is there a need for it? And that's where anything starts. And sometimes people are innovative and they guess what people want even before they tell you. But most innovation, you kind of can figure out what people want even before you launch a product. So that's the main, how big is the opportunity? How big is the market? For something like Caries, it's a big market. Everyone needs it. It's a big problem. So that was never an issue. The step from there is the team right? And with the sort of the scientific chops that the team has, I thought it was definitely the right team, and the environment of sort of having access to people like the dean and the vice dean in this environment of the HSDM, that's been very helpful too. I think it's been indispensable for a young company that's nearly virtual right now to survive and go find the partners. And the third step would be to, of course, the IP and the patents, and all those are ingredients in creating a defensible product and a defensible business. But finding the right partners in the real world, I don't know if it's a dental products company or a toothpaste company, who can help get the product to the right people and make the people who need it aware. And that marketing is going to be the biggest challenge for us going forward.
Yeah, and this is a very interesting aspect, you know, and the question that we often face is, when is the right time to file for your patent? Because with that also implies that you are disclosing your idea and you are exposing it. You know, filing a patent is not a one click online and then you are protected. So what was your experience in going through the IP process? How do you protect your confidentiality until that patent is duly filed? Yeah, Michael, you can.
So I'm involved in another project, or a couple other projects that involve in intellectual property. And one of them is actually going through some IP law and being patented. So some of the things when we engage different manufacturers or product consultants, what we do is we have them sign non-disclosure agreement or confidentiality agreement. So they'll initially sign that. And then there are many small things that you have to understand within it, that it's not only what you show them, but also what they give you that you can't disclose. Mm-hmm. So those are some of the things or ways to kind of protect your idea. And also, when you actually go into the actual patent law, obviously you want to talk to somebody who's experienced in healthcare, and especially if it's dentistry related, is something that you want to talk to somebody who's experienced in dental laws and products. And also in the process of writing the actual patent, what you need to do is basically write it as broad as it can be. So specific drawing like that, maybe you want to dumb it down so as big as it gets, so that you don't corner yourself, so that you don't create a patent that, and at the same time you're excluding yourself into other potential designs. So those are some of the things we faced, and we have gone through several iterations of changes because we want to be broad as possible and as inclusive as possible.
And what do you guys think about provisional patents? Is that the path that you will probably take, or?
So it's also another thing is what's patentable. So what's out there already, and also how noble is this, the idea of it, and there are many strategies in terms of if you should patent something, because there's also cost involved and the time involved, versus can you beat it to the market and you're the first one out there. So obviously Google, MSN and things like that. They're not really patented. I'm pretty sure within their algorithms they have something, but it's more so the brand name that also gives you some power to your product and how marketable it can be. So it's a provisional patent, yes and no, depends on the product, I'd say.
Any questions from the audience?
I might add one thing that people want to know about. There is now an associate provost for technology development at the university, and that came about, probably about 10 years ago. His name is Isaac Kohlberg, and he's a fellow who actually patented a MS drug at the Weizmann Institute in Israel many years ago that brings in a lot of money to the Weizmann Institute each year. And he came here, he's a very nice fellow, and he established these offices of technology development. Grant Zimmerman is the person who services the medical area, and he's been very helpful. The school has had some success in this. As a matter of fact, the office here, probably the most successful patent was Sam Lynch's patent on a bone substitute called Gem 21, which took 10 years to develop, but actually brought in significant money to the School of Dental Medicine. I just exchanged emails with him this morning. He lives in Nashville, Tennessee, because he was the recipient of the Distinguished Alumnus Award last year at this time, and he couldn't come. He thought he might be coming this year. So 10 years, it's a long time. It's not just like that. As a matter of fact, I hold a patent. What do I hold a patent for? I hold a patent for the use of haptics, which is touch and feel on the computer, to teach dental things. My hope in doing that was to get rid of live patient exams so that students could do on teeth. Enamel feels like enamel, dent feels like dent, caries feels like caries, and teach in a simulated way of surgical simulation. And in fact, the one thing it got from me was a lot of emails from companies that want to sell you something that honors the fact that you hold a patent. It's very flat. We licensed it to someone. It hasn't gone very far, but just to show you the complexity of this, there's a company in Europe, Move, that has developed a similar simulator, and we only hold a patent in the United States. And now they're starting to sell it in the United States. So guess who gets involved? Attorneys. But it's a very complicated process. And I think one of the things that really has been instrumental in this is seeing someone from the business school. That the deans of all the schools form an executive committee for this Harvard Innovation Lab, which is in the old GBH headquarters over in Alston. One of the most significant things we had to do was to vote to close it at 3 a.m. because there were students from all schools working all night long in teams to develop these products. And so they team up, one project teamed members from the law school, the dental school, the business school. But, you know, you mentioned how important the business school is. It reminds me, Regina Hertzlinger, who's a professor over there, has invited me each year to teach a class on a Brazilian dental insurance company. And every year she says the same thing to me. Bruce, you're a nice person, you're a smart person, but these are business students. They're not interested in public health, they're interested in profit. I told Sid, I thought this had the possibility to be a pregnancy test. Right?
Now we welcome questions from the audience. Yep. Please.
I have a question about the TAVR test. I'm a pediatric dentist, so a lot of the lesions, and I work with a high-risk population, so most of the lesions I deal with are actually interproximal lesions. What application do you have for interproximal lesions? Or are these only to detect lesions that are incipient on virgin teeth? And what about recurrent lesions? Would you be able to pick up any positives on this if you had a recurrent occlusal lesion or recurrent DO lesion under like a composite or amalgam restoration? Like, can you comment on that? Very good question.
Thank you for your question. you're right, interproximal lesions are a big concern. And unfortunately for this version of our product at the moment, it's primarily for occlusal lesions only. However, because it's detecting demineralized areas, it can detect secondary lesions as long as there's, and presumably there are demineralized areas. Interproximal, maybe in the future, but right now, not really.
Any other questions? Yes?
I guess my question about the cavity test is that, is the concept going to be to try to maybe get a licensing agreement with like Colgate or one of those big companies so that they can take this and have it like hanging on the shelf next to the toothbrushes so the average person goes to the store and says, oh, maybe I have a cavity, and they bite down and say, yes, I do? Or is an application like using it for advanced screenings in third world countries, or what type of what's your goal, or what are your potential goals of this?
It's both of those, and potentially also in the dentist office as a early screen that could be done before the patient walks in for a clinical exam. So you have an idea of where to look for problems and how to advise the patient and sort of maybe do a basic risk assessment using this product. So
it's nice to have the parent believe you if you're telling them it. My clinical suspicion is that this is a lesion, and like you were saying, in certain cases it's not very obvious.
Yeah, and we also think there might be a big behavior change impact from looking at the image of cavities in your teeth. And that's what one of the trials that we're planning is to test how much behavior change impact we can create if someone uses it every 2 months or every month. Will it improve their sticking to a diet plan or a no soda plan or a use the specific floss plan or something like that? So that's what we're going to test to make sure we understand what the behavior change impact is. But that's got implication on public health and for the over-the-counter and for the dentist office as well. No, actually, that's all.
And I will add to that, I like your question very much, but it could become also a negative test for every patient visiting the dental chair, right? That you can, test it on a regular basis as a part of the routine exam.
Right.
So, yeah.
I mean, I wouldn't limit yourself either. I mean, think about it maybe as a modality that you can put in the physician's office so that they can, it's a really good way for them to, like pregnant women that walk around with extensive lesions, maybe they go to their first OB appointment, this is part of their kit, and
exactly.
then here's a list of dentists to go to, please get this taken care of.
You know everything what you're even thinking.
So I think you got a new team member here. Nancy?
I want to ask about mass production. So, for example, with the liquid toothpaste delivery system, if you have a motor and it breaks, are you thinking, if I go to mass production or I sell my patent to Colgate, it may not be as pure as what you created?
Exactly.
And then, say, with the cavity test, how would you, maybe in terms of the science, make sure if one test works properly and another test doesn't work properly? Are there any mechanisms built into thinking that far along to mass production to keep it pure in terms of what the original product is for both of you?
What you mean is if it's electric and the motor breaks or something like that? I haven't really thought that far, but I think we can have an extra motor, probably like a warranty thing for a couple of years, or it could be cheaper to buy a new one. So that's really a business decision and economical. But thank you, that's a great question.
Yes?
As to the liquid toothpaste, did you mention the ingredients of that toothpaste?
I haven't yet. No, I can't disclose that yet. But it is done, and it is stable for many years. I have a prototype. I made a prototype. So it can definitely be done on just a regular basis without adding a lot of other ingredients. So you can add antibiotic, you can add Paradex, a lot of different materials.
And all the key ingredients we believe in.
I'm sorry?
And all of the key and major ingredients we believe in, like cavities, decay.
Yes, yes. Yes, it's exactly like regular toothpaste in a liquid form. So whatever the regular toothpaste does, this product can do in a liquid form, yet you can add on a lot of other things and hopefully specific to the patient's needs. That's what I'm looking for, prescription toothpaste specific to the patient's needs.
Phil?
When you say liquid for a toothpaste, define liquid.
Liquid is something that flows and you can put it in a pump and you can pump it and it comes on top of a toothbrush and it does not spill over and stays on the toothbrush and the person can brush with it. That's the definition.
It's almost two different things. Is this a colloid you're talking about?
It's liquid.
So it's a flowable liquid.
It's a flowable liquid.
But are most pastes colloidal? And if they're colloidal, when you brush teeth, then that material stays on the teeth in a different way than a flowable material like a soap.
No, this does not.
Structure is very different.
Unless there's a purpose to it. Unless if you want to add fluoride or antibiotic and then you have to design it that way. Otherwise, the basic structure is just for brushing, exactly like a toothpaste. It has the same components and ingredients of a toothpaste. However, it's in a fluid shape. It flows. You can pump it, and ease of use. Ease of use.
If you can put it on a toothbrush and it doesn't flow, is that right?
That means it's flowable enough that stays on the toothpaste.
Phil,
Why?
I think you will have to invest in a second patent now, too.
No, it's not. It's, I don't know, maybe.
Because the biological factors of it, if you push it, then it squishes.
Why do you have to push something? It's in a pump. The pump drops on the toothbrush, and then it does not drop all over. You can use that toothbrush, take it to the mouth, and brush. Believe me, I have done it. There's a prototype made. So I'll be able to share it with you later if you want.
Excellent. Thank you. So, yes, we have one more question. Yeah?
I have a question about the technology of
And talk.
It's a really great idea. The only challenge I have is that I work at an organization where we have a pretty massive electronic health record, and the our electronic dental record is within that, and it's not really good on the dental side. But how would I be able to use this type of technology? How does it integrate with an electronic health record or an electronic dental record? And how do I get stuff out of that and put it onto there? And vice versa, like if I get a consult on this, how do I have documentation into my normal EDR that I've done that consultation, or that I'm making my decision based on that communication with an outside provider?
Okay, so currently you guys know about HIPAA and the other high-tech rules and things like that. They basically define how the electronic health record should be formatted and stored. So there are certain standards, even though some of these different EHR software, they seem different, but if you look at the back end of it, it has to be formatted a certain way. So we can embed certain bridging software that we can go inside the software or the stored data. We can import stuff back into our DentTalk software. So that's all in the works. Right now, what our goal is basically is just to disseminate as much as we can and have users to interact. And then once we have that model going, it's a social network effect. We basically have other means to do other things. So we're just trying to create a basically network so that you guys can freely share first. And then when we have these premium features, we may target to charge you certain fees or things like that.
Additionally, all the conversations that are had through the messaging platform can be downloaded off of the device in a PDF format securely and can be uploaded into the EHR, whichever EHR is needed for that. And so.
May I ask who you work for?
I work for, it's called Community Health Centers, CHD, it's in California.
It's a federally qualified
It's in
health
the
center?
QA state, yeah.
Now, we have a little bit of time left, and I thought that we can revert the dynamics of the conversation And how about if we ask you what innovations are needed in your reality, in your daily practices? Can you name a few or one? Can you just come up with something that if you were allowed to dream, you say, I would like to have this. And perhaps we can make some new innovations beginning today. Anybody? I'm sure you have those. Yeah.
We have a classmate in medical school by the name of John Adler in our class, who's a full professor of neurosurgery at Stanford. And I've remained in contact with him all these years. And he developed a company called Accuray. Don't quote me on this. And it's stereotactic robotic surgery. It's either surgery or radiation, which he did sell. And today at 12:30, he's given another lecture called Curious, C-U-R. He started another company. And if the class of 1980, we all remember John Adler well. Yeah, he was my partner at the Brigham on our ICM, Reduction in Clinical Medicine rotation, and we all remember our partners. He was mine. Anyways, he's going to lecture 12:30. So I jokingly say to you is the oral surgeons in the room would ruin our business, but a stereotactic robotic way to take out teeth or actually to, restorative procedures, which we probably don't want to happen or we will no longer have careers. Robotic surgery, it's up next. That's in the works.
Yeah. Anybody else? Yeah. I knew we had many inventors in the room.
Well, I'm not a dentist, but I am a parent. And I do have a couple of ideas.
Okay.
I think for myself, my children, I work here at the school. My children do come to the dental clinic. And I think one thing that, for me, I've seen is that my children are 9 and 11, and they're very tech savvy. So for me, if I had an app that simulated going to the dentist, simulated, tooth extraction, cleaning, something, because they will use it, they'll play with it. Anything that's a game and an app on an iPhone, they'll pretty much play with it. But I think it may ease some of the anxiety that children feel about going to the dentist if you make it something that they're a little more familiar with before they even get there.
I see everybody getting ready with their pens and paper, so let's go on. Who else? There's no prize. Phil, you had something?
Yeah, when you talk about when you look at the impression material and you say whether it's decayed or it isn't decayed, in a theoretical sense, would there be a way of sealing off these areas so that you didn't have to drill them?
Like to treat them with
Well, you can use sealants, but they don't always go into the hole. So is there some way that you can either use a different medication for any of these areas without drilling, provided it's very early stage?
Okay.
We've done remineralization work with several products. One of the ABA developed an Enamel line. It's back. Premier bought it. Hafrosol was a patent that I sold for $1. Went on to sell for $5 million to my former dean. Benefited from. But I've done 65 randomized.
You mean Ronnie Norris?
No, Johansson.
Oh, well, Lonnie's an alumnus. I thought he made all that money. I thought
So what is it that you would like to see that you would say, this is what it will really be a game changer in your field?
It's great to identify early lesions and remineralize them. I think you're not going to love me if I promote remineralization, but I think that's very important in dentistry.
I think it is.
Sealants have worked very well to prevent the demineralization from occurring, and this technology would be good to pick up leaking sealants,
Mhm.
early human around it, that kind of thing. So in children, I think it would be great. In the geriatric arena where I work, we're far beyond this technology because
It's so
we
different.
have decay, we have root caries,
Mhm.
it's a whole different picture.
What would you need?
Me?
Yes.
Well, I was going to say something that was, it's kind of stupid, but
Ah.
basically the biggest challenge I have, and one of the biggest challenges is communicating with patients. I work with, most of my patients don't speak English, a lot of them speak Spanish, but a lot of them also speak Mixteco, which is a Oaxacan dialect,
Mhm.
and even when we use the 1-800 translator line, they don't always have Mixteco translators readily available, and it's a real pain because we're usually at the surgery center and trying to do pre-op consultations, and there's not, somebody who speaks Mixteco. And I was wondering if maybe, maybe they do have an app or something like that, some technology for translation. I think Google might have something like that, but it'd be nice if they had. I'm just shocked that a 1-800 service for translation that we're required to be able to communicate doesn't always have that readily available. So,
Or it could be a new feature of Dent Talk. Any?
One of the things,
Mhm.
and this is absolutely a true story, I'm fond of saying one of my wishes is to take the drill out of the dentist's
Yeah.
There are medically treatments
Mhm.
of surgical diseases.
Mhm.
You mentioned some of them. ART can be antiretroviral therapy, but it also can be atraumatic restorative dentistry.
Mhm.
But just last week, Dawn Olson, our Dean of Research, received an email from someone who works for a company that has developed a laser that apparently can do hard tissue as well as soft tissue. I've used, and many of us probably have used lasers on the gums and other soft tissues, but it's not exactly ideal for doing crown preps or restorative dentistry. But apparently this one is. But the interesting thing about it is I'd love to come speak to you about potential research collaborations. She gave me that list too. And but I'm also the great grandson of the founder of their school, Nathan Cooley.
Very interesting.
So maybe it's serendipity.
All right. Well, I think we are perfectly on time. I was asked to finish at 15 to noon. So I would like to thank all our panel members for their interesting stories and great journey into getting these ideas to realization. I hope I'm sure it's my wish and the wish of everybody in the audience that you do succeed, that your ideas are hitting the market not only to make you proud and wealthy, but also to help the population in reducing the incidence of these caries lesions and helping clinicians to communicate better. I think this is all loyal and very honorable goals that you are trying to reach. Thank you very much for your time and dedication. I would also like to thank Jesse, Nancy, and Wanda and all Office of Development for putting this together. It was a great idea. Jesse, thank you for writing my script here. I know that I skipped some paragraphs, but the overall goal was achieved, I guess. And now I hand off the podium to Jesse back.
Thank you, Dr. Gallucci, and thank you, panelists. So, before we leave this room, I'm going to have a quick check presentation. This year, we challenged each of the classes to increase their participation in reunion giving. The class of 1960 stepped up and met that challenge, reaching 78% participation in reunion giving this year, which is outstanding. Their class will be honored on a plaque in the REB lobby right outside that will, going forward, recognize all of the classes that reach at least 75% participation in reunion giving each year. Will Dr. Ed Morin from the class of 1960 please come forward? You can just stand there for a minute. I'll bring the check out for you. Okay. So this check actually represents the total amount given by all of the reunion classes towards their class gifts this year. So the classes of 55, 60, 65, 70, 75, 80, 85, 90, 95, 2000, 2005, and 2010. It's $57,415. Dean Donoff, will you please come up and accept this check?